My name is Ritnesh Vishal Prasad, and it is a pleasure to facilitate this session as part of the Pacific School Food Talanoa 2026. So before we begin, I would like to acknowledge all participants joining us from across the Pacific region and beyond. Thank you for being part of this important conversation on future of the school food systems and child nutrition. The presentations in this session will explore imaging evidence on the nutritional status, diet quality, and the school food environments of children across specific contexts. Together, they provide valuable insights into the realities facing school-age children, including dietary patterns, lunchbox quality, school food environments, and the ongoing double burden of malnutrition. Importantly, this session is not only about sharing the research findings, it is also about reflecting on what is working, what remains challenging, lessons that are learned from implementation, and also opportunities for regional collaboration and priorities for strengthening the Pacific school food system moving forward. Without further ado, let us begin with our very first presentation. Our first presenter is Mrs. Kriti Chand from the National Food and Nutrition Center in Fiji. Mrs. Chand will present on the strengthening school food environment through nutrition literacy for boarding schools in Fiji. Please join me in welcoming Mrs. Kriti.
The Honorable Assistant Minister for Health, ladies and gentlemen, a very good afternoon to you all. I hope you all enjoyed your lunch. That's great. So I'll be presenting on strengthening school food environment through nutrition literacy for boarding schools in Fiji. Just a brief QVS. These are two prominent boarding schools in Fiji. And what happened, how we came to do this program was through support of FAO. So they did a mini survey and found out that the students who were boarding in the boarding school, they were not very happy with the meals that was provided to them. And of course, we understand school food environments are essential for supporting student health, well-being, and academic performance, particularly in our boarding schools. So in Fiji, concerns relating to food safety practices, meal quality, nutrition literacy, especially for the food handlers, food waste and access to healthy foods highlight the need for strengthened capacity building and improved school food systems. So our nutrition literacy program was done for the food handlers, which were the cooks and the kitchen hands who daily prepared meals for the students. So this initiative aimed to strengthen the knowledge and practices of boarding school food handlers through nutrition literacy, food safety, practical training in value-added foods, preparation aligning to the FAO school food and nutrition framework. A mini survey was carried out for boarding school students, where almost half of the students rated the food that was being provided by the school was neutral in taste, and 20% rated that the food did not really taste good. So the survey also found out that meals were repeated. So in a week, 2 or 3 times they were given the same meal. And it was very limited in food variety, especially when it came to fruits and vegetables. And the perceptions of poor meal quality among some students was they rated it very poor. So when we did the training on nutrition literacy, these were some of the objectives that we carried out on. Improving the food safety knowledge, strengthening hygiene practices, promoting safe food preparations, and improving food service quality for students as well. So apart from the theory part, we also did practical sessions, hand washing demonstrations, kitchen assessment, so that these assessment could be given to the board members and they could do some changes to it. Also safe food handling practices such as wearing of hair nets, hand gloves while handling food, also storage of food, how to receive fruits and vegetables among meat, and how to handle them and store them. And also, when it came to value adding meals, this was for the leftover foods. So, especially when it came to starchy staples, cassava, dalo, these leftover foods were used but were fried often and given to the students. However, with our practical sessions, we uh, developed some healthy snacks in a healthy manner. So one of the food that or snack that we helped prepare was patties, tuna patties, using the leftover staple with tuna and some vegetables. So this became a healthy snack for the students. Some of the challenges that were highlighted by our participants, which were the food handlers and the cooks, limited sanitizing supplies. So they did not have enough supplies for soap or hand washing detergents, even to the cleaning agents. Storage constraints. Sometimes when food items were purchased in bulk, they ran out of space. Equipment store shortages. Some of the equipments that they were using were outdated and were not replaced on time. Operational issues in meal preparation. So sometimes when the cooks were preparing meals, the management overruled what was to be prepared. So it was not the cooks or the kitchen staff who were actually preparing the menus. It was the management who did the menu planning for them. And of course, limited budget. Some of the opportunities that we saw was QVS and RKS, they have a lot of space for farming. And with the support of FAO and Ministry of Agriculture and Waterways, these space would be utilized as their farm because the students were showing a lot of interest in school gardening and food production activities. So FAO supported these initiatives. This was just one of the phases of the program or project, nutrition literacy. The second phase of it is having the school garden established where the students will be competing amongst themselves. So they are divided into 4 groups and these groups will compete amongst themselves and plant vegetables and fruits, which will be supplied to the kitchen. And using those produce, we will guide them how to prepare a menu and meals which are nutritious and healthy for their students. So this initiative has shown an importance of combining nutrition education, food safety, and practical cooking to build a healthier, more sustainable food systems in PG's boarding schools. Ongoing teamwork across sectors, regular refresher trainings, improved monitoring, and greater student and staff involvement in food activities are recommended to create a sustainable, nutrition-focused school environments across the Pacific. And of course, partnership with FAO and Ministry of Agriculture and Waterways has also led to cultivation of farms, which will be of great help to the students' meal preparations. So before I end, I would like to show you a video of all the trainings that was carried out during the 2 days. So these were the students, our food handlers, who were trained on food safety and nutrition literacy. Sorry. So these were our food handlers during the training, and they were sharing their experiences and what they go through daily when preparing meals. Our dietitian from Korovo, she was presenting on the practical sessions of what we would be doing. This was one of the recipes that was used, and so they were, after preparing the meals, they actually came back and they had other groups coming in and tasting how they prepared the meal, the snack. They were divided into groups. So this group was grating the carrot. They drained oil from the canned tuna to make it a bit more healthier. Majority of the food handlers in these two schools are males. And this was one of the kitchens for RKS. And that's all from my side. Thank you.
All right, thank you, Kriti, for sharing those valuable insights into nutrition literacy and the important role it plays in strengthening the school food environments. Our second presentation takes us to Papua New Guinea and explores differences in diet quality and nutritional status among children from different socioeconomic settings. Please welcome Professor Georgia Galden from the University of Papua New Guinea, presenting on comparison of diet quality and nutritional status among PNG urban students in preschools of higher and lower socioeconomic levels.
Good afternoon again. Okay, I think you've heard the title already. This is a project of one of my public health students. I teach public health and nutrition at the University of Papua New Guinea. And Mr. Tude, he was interested in the differences in the higher and lower socioeconomic group kindergartens to see if those children were eating similar foods or not. So let's jump in. And then he also wanted to look at their health status. Ooh. I'm looking for the, nope. I don't see, okay. Okay, this took place in two urban preschool settings in Port Moresby, a high socioeconomic or private preschool and a low socioeconomic or public preschool. And we compared preschooler diets and the diet quality and the nutritional status between the two schools. The tuition fees in the two groups were very different. The public school was almost free, and the private school was probably about 10 times more for the tuition. We had a couple of questions that we wanted to know about, and that is, were the two groups of children eating the same foods, and was their nutritional status the same? Our aim was to assess and compare the nutritional status and diet quality of urban children attending a private versus a public preschool. And we wanted to ask the question, are socioeconomic status differences represented by two preschool types already important factors when considering children's diet quality and nutritional status? This was a cross-sectional study, and we went into each school once, and we did all the data collection. There was a private school with 45 students who participated, and a public school, preschool with 81 students who participated. We used convenient sampling. They were the students who were attended that day from our university's research ethics committee, and the school principals gave us access to the school. Our response rate overall for these two groups was 73.7%, or 123 out of the 171 students. Some of the data we collected was anthropometric data, and we measured the heights and weights of the children using the standard WHO procedures and equipment. And this is a height measurement in the lower socioeconomic preschool. And we calculated the WHO standards, weight for age and BMI for age Z-scores for undernutrition and overnutrition for each child. For dietary assessment, we had a parental questionnaire. It's called the Diet Quality Questionnaire. It has been used in at least 140 countries. And it's a yesterday food consumption of 29 different food groups. And they have things like different kinds of animals foods, leafy greens, different kinds of sweetened beverages, red and orange vegetables, other vegetables, things like that. And so we were looking at their diet diversity and the NCD, non-communicable disease risk scores. Were they eating foods that maybe led to obesity or cardiovascular risk later in their life, or that could lead to that? First of all, we looked at the age distribution of children attending the schools, and we saw that the public school children were generally younger than the private school children. You can see there that the public schools children were limited to the 3, 4, and 5-year-olds. The private school children were limited to the 3, 4, and 5-year-olds. But the public schools started with the 4, 5, and some 6-year-olds in the class. People send their children to primary school when they think they're ready or when they think they can go. This was some of the food groups for our food consumption group by school type. You can see across the bottom, we've got listed the energy foods, like that's the rice, breads, and the buns, and the whole grain rice. We left out root vegetables because almost everybody had some of those, but some leafy green vegetables. We included fruits, the orange and yellow fruits, sausages and processed meats, other meats, fresh meat, game meat, poultry, chips, like potato chips, twisties, golden nuggets, and cheese puffs. These are little dry snacks that comes in bags usually. And teas and coffee with sugar, which is the most common sugar-added drink for this age group and for a lot of them up through secondary school. Fruit juice, fruit drinks, cordials, and lime water, other sugar-added drinks, and then soft drinks. But for all of these food groups, you can see that the red bars or the brown bars, that's the private school, they're all, a higher proportion of those are eating those foods more than the public school students. Also, we saw that there was a difference in dietary diversity. We used a dietary diversity score that has 9 food groups. And if you eat more than 4 food groups, you're considered to have a diverse diet. Diet diversity is important because the more groups of food you eat, the wider constellation of nutrients you should be getting. And so we think that any more than 4 food groups is adequate. So we had about 5 students who did not meet the dietary diversity at all. They were under 4, but they were all in the public school. And when we looked at the average dietary diversity scores, the private school ate a bit significantly more, 8 groups, food groups on average, compared to only 7.2 groups in the public school. The public school children had both higher underweight, 12.3% versus 0% compared to the private school, and overweight, 14.8% versus 6.7% when you compare it with the private school. So the public school students had more under and overnutrition than the private school students. And that meant that the private school students showed a higher proportion with the healthy BMI status compared to the public school. 95.6% of them were in the healthy range versus 82.7% in the public school only. The private school children face greater non-communicable disease risk from risky food groups consumption than the public school children. The private school students had only 4.1 NCD. Oh, I'm sorry. Private school students had more NCD risk food groups than the public school students. they had maybe more food budgets. They could afford maybe the soft drinks or the other treats that the lower socioeconomic groups couldn't afford. So what does that do for their future health? So far, they were all right in terms of BMI and health status. So the differences we saw were, if we look at the lower versus higher socioeconomic group children, the age distribution, we had the older students in the public school and the younger students in the private preschool. And for nutrition and health, there was a little bit more limited nutrition access in the public preschools compared to the private preschools when we look at the dietary diversity. And the public preschool had lower dietary diversity scores, and the private preschool had the higher dietary diversity scores. And public preschool ended up with more students with less healthy weight status compared to the private preschool children with more healthier weight status. So the impacts, we did see an economic divide of the food they're eating, an economic divide, a health outcomes divide. And what will this mean for their future growth and health? We don't know how long these will persist, what will happen. But we do recommend that we should try to have policies and programs that can bridge the gaps and improve access to nutritious food for all children, promote healthy eating habits across all socioeconomic levels, add nutrition to all preschool curricula, including reaching to parents at that age, because they're getting most of their food at home, and this is usually taken care of by their parents and caregivers. And also we want to address the underlying social determinants of health. Thank you.
Thank you, Professor Georgia, for those important findings on dietary diversity on children's nutritional outcomes. Our second last presentation is by Mrs. Sainimere Wulimbedi. She's the Divisional Dietitian Northern within the Ministry of Health and Medical Services. Mrs. Sainimere will present on findings from a multi-year surveillance and lunchbox audit analysis that is conducted among primary school children in the Northern Division of Fiji. Please join me in welcoming Mrs. Wulimbedi.
Good afternoon. Today I am Sainimere as on the slide, and I work in the northern part of Fiji in Lambasa. I'm sharing findings today from a retrospective study examining two interconnected issues in our northern division: how our primary school children are growing with their nutritional status and what they are actually eating when they arrive at school based on lunchbox audits. So these findings is over 5 years of surveillance data from 2021 to 2025 and lunchbox audit for 2 years. So just a brief background, the Pacific region is well known for what we call the double burden of malnutrition as previously presented, meaning children are simultaneously affected by undernutrition, such as thinness and wasting, and overnutrition in the form of overweight and obesity. And this is in the midst of our flora and fauna. Fiji is not exempted from this pattern, and within Fiji, the Northern Division presents its own unique challenges that have not yet been thoroughly studied. So as mentioned, in the Northern Division, we have 4 subdivisions: Maduata, the Kaunrove, Taviuni, and Bua, a geographically dispersed mix of urban, rural, very rural, and remote island primary school communities, predominantly Itauke and Indo-Fijian. And our dietary profile reveals low intake of fruits, vegetables, and protective foods, high consumption of refined carbohydrates. And for your information, there has not been any prior study that has integrated anthropometric surveillance with lunchbox dietary adequacy data for Northern Division primary school children, which is the reason why it motivated us in the North to compare our nutrition intervention program, which is the lunchbox audit, together with the anthropometric surveillance data. So this is the first time we are coming up with this original study. And there are limitations. I need to acknowledge that there are limitations to it on the administration data. Okay, the objectives. We'd like to describe the 5-year trend in the nutritional data, which is the normal weight, moderate thinness, severe thinness, overweight and obesity across the Northern Division. Characterize the composition and dietary adequacy of school lunch boxes assessed during structured audits for year 2022, 2023, and 2023-2024. In Fiji, our financial year starts from August. So this is why I'm writing financial year from August to July. And we'd like to examine the ethnic differences, Itaukei, Indo-Fijian, and others, in both nutritional status and lunchbox dietary patterns, as this is how we collect data normally. And also identify evidence-based programmatic implication for school nutrition interventions in Fiji's Northern Division. So let me briefly walk you through our methods for nutritional status. We used annual Northern Division School Health Master Sheet. So we have a School Health Master Sheet that captures nutritional status of each child that's assessed for all the schools that we visit. And this is covering all 4 subdivisions in the North. Children were classified using WHO growth reference standards into 5 categories. For the lunchbox, we conducted structured assessments across 37 schools in financial year 2022 to 2023, and representing a roll of 9,000 students, and 42 schools in financial year 23 to 24 with a roll of 6,559 students. So we assessed 8 dietary adequacy categories ranging from carbohydrate only to a fully balanced meal with combinations. So carbohydrate only, protein only, and protein is meat source, and protective foods only with combinations of carbohydrate and protein, carbohydrate and protective food, protein and protective food, with fruits only and balanced meal. So we, the analysis, it's a descriptive statistics with frequencies and proportions. And the lunchbox audit is an observational study. And the second audit visit, as planned, usually we don't have the opportunity to do a second visit to do a follow-up. So we visit for the first time with our lunchbox assessment. We don't have the opportunity to always visit the second time in the same year. So that is one challenge that we face. We have challenges around that environment because lunchbox audit was supposed to be as part of our nutrition response activity in what we find in schools, but we always find challenges with HR, transport, time, because we are heavily engaged with other programs and activities. So with nutritional status trend, over 5 years, we monitored over 100,000 students, 100,207 in total, with an average program coverage of 89.9%, which is, to us, we feel that it's a reliable statistics to work on. The broad headline is positive in one respect, like normal weight remains stagnant or stable at around 89 to 90%. And the undernutrition improves from the study. From severe thinness declined from 4% to 3%, and moderate thinness declined from 2% to 1%. So however, with a red flag is overweight and obesity has increased from 5% in 2021 to 7% in 2025. So this is a 40% relative increase. So this is a summary table of the school analysis master sheet for the 5 years from 2021 to 2025. You can see the gradual improvement in thinness rates and simultaneously the steady climb in overweight and obesity highlighted in the 2025 column. So coverage remained consistently high throughout, above 88% every year. So we have a very good coverage for our school nutrition program. This is the nutritional status trend. This slide summarizes the key numbers visually, as mentioned earlier. Over 5 years, 100,207 students. So there's a 89.9% coverage. And there's an increase in overweight and obesity, while moderate thinness and severe thinness has reduced, our overweight and obesity has increased. We move on to our lunch audit overview. For our lunch audit, we do findings according to balanced lunchbox, carbohydrate only, and a combination with fruit inclusion. And let's move on to the summary at a glance. So we increased the number of schools from 37 to 42, and the total roll reduced. So that's an interesting, while we increased the school, our total roll across audit had reduced. For your information, school lunchbox audit is only conducted to schools that are ranked as a problematic school with nutritional status, and meaning they have a problem with undernutrition and overweight and obesity. So we rank them. We rank all the schools in the Northern Division, and we choose the top 5 to 10 schools to work on in each of the subdivisions. So let us look at the lunchbox by ethnic group. So the Itoke children started from a very strong position when we started the lunchbox. So nearly 1 in 3 lunchboxes was balanced in the financial year 2022-2023, but in 23 and 24, that had fallen to under 1 in 5, so a drop of 13%. And the individual children had the lowest rates across both years. Okay, only 4.8% had balanced lunchboxes in 23-24, and that is fewer than 1 in 20. Their carbohydrate rate was also the highest at 22.9%. So for carbohydrate only, only lunchboxes, these are considered the least nutritious category. They lack protein and protective foods entirely. So Indo-Fijian pupils had the highest rates, rising from 19.8 to 22.9% of carbohydrate only. That means more than 1 in 5 Indo-Fijian lunchboxes contain only carbohydrate food. So for Itoke children, the carbohydrate only rate nearly doubled from 11.7% to 18.3%. So the only group to improve was others, the other group, which had 10.6 to 8.6%. So a small positive signal in an otherwise negative picture. So for the category breakdown, the slide shows the full breakdown of all 8 dietary adequacy categories for the financial year 2022 and 2023. And the key observations, so even in the better year, which was 2022, or 2021 rather, carbohydrate-heavy combinations dominated. So this reveals that carbohydrate food were packed in lunch boxes for our children. And balanced meals were a minority across all groups. Protein and protective combinations were negligible. So the breakdown for 2023 and 2024, comparing 23 and 24 for the previous year, the shift towards carbohydrate-heavy lunch boxes is visible across all groups. And balanced meal categories contracted. Fruit-only categories are near invisible. So balanced meal categories, this is not a variation, but it's a consistent directional worsening across the board. So for fruit inclusion, we also observe, we always check on children bringing in fruits as part of their lunchbox. There's, I want to draw your attention here because I think it has involved challenging issues that we face in Fiji. A lot of people do not like to eat fruits, and this is also evidence in the lunchbox of our school students. Hardly any of them are bringing fruit as part of a lunchbox to school. So fruit inclusion was already low, and 23-24, you can see that there's a collapse to under 1% for every group. So we understand that there was COVID, and COVID had brought a lot of challenges to the building up of our schools and the school lunches. So that is why sometimes it's a very sensitive situation in some areas in the rural where whatever they bring for lunch is the only thing available to them to bring. Okay, so we feel that recommendations, they need to be guidelines, standard guidelines developed culturally tailored so that, and multilingual lunchbox guidelines for caregivers, targeting those high-risk groups that are not focusing on a proper lunchbox, and also focusing on a campaign on fruit and protective food campaigns so that we see our lunchboxes reach in this, as showed in this study, that a lot of them are not bringing fruits to school. So I'll jump into the, so with a double burden for thinness, we have seen that there's a decline and there's a rise in overweight and obesity. So this has confirmed what is present already, maybe across the Pacific. And we'd like to see policies in place. So our recommendation is to have proper lunchbox guidelines to be developed, caregiver education materials to be developed, policy engagement, especially with Ministry of Education as well, so that we see that what's happening in the school environment is something that will contribute to the well-being of the child. And also incorporate, strengthen the research to conduct a second visit during the same year of visit. Lastly, I'd like to just acknowledge my team of supervisors in the North, Madhuwata, Reshmi from Madhuwata, Anita from Savsavu, Nazrin from Taviuni, and Mary from Bua. And not forgetting Ritnesh Vishal, sir. He contributed when he was working with me in Lambasa before coming across to the school in developing our electronic data where we capture this assessment, the surveillance data. Thank you.
Thank you, Mrs. Bulimbedi, for presenting this valuable data. And it was fortunate, I was fortunate enough to be working under as a dietitian in the Madhuwata subdivision. Moving on. So now we move on to our final presentation for this session. I will be presenting this on behalf of Ms. Lynette Chand. This presentation examines the impact of school-based nutrition intervention on underweight among students at Nasavasavu District School. So Mrs. Chand is the acting senior nutritionist at the Fiji National Food and Nutrition Center that is within the Ministry of Health and Medical Services. For the introduction, so rural and semi-rural communities, they may face challenges in accessing the diverse and nutritious foods due to economic, geographic, and also food system factors. I think the previous presenters have already set the pace for this. While significant attention has traditionally been given to children under 5 years of age, school age children remain a nutritionally vulnerable group and are frequently overlooked in nutrition policies and interventions. Evidence on school-based nutrition interventions in Fiji remain limited, but particularly for addressing underweight among primary school children. Moving on to the study objectives. The objectives were to assess the prevalence of underweight at baseline among students at Nasavu District School. Second was to evaluate the changes in the weight for age Z scores following a 6-month multi-component nutrition intervention. The next objective was to assess the changes in nutrition knowledge and dietary practices among students pre and post-intervention, and finally to describe the level of parental and teacher engagement that was achieved through the intervention. The study overview. The school is located in Drakongrove province, which is in Vanua Levu, so the second largest island of Fiji. The school is a semi-rural community and has years 1 to 8. The students age between 6 to 14 years, and it is a mixed Itaukei and Indo-Fijian population. The participants were 31 students that were all underweight. So what they did was they did the nutritional assessment for all the students, and the ones that were classified as underweight became the participants. So that was sort of intake criteria. There were 16 boys and 15 girls that were included in this study. The design, so there was a baseline assessment, and then there was 6-month intervention, and then there was a follow-up in assessment. Moving on to the baseline assessment. So what did they measure? There were 3 things that they measured. The first was the nutritional status, of course, using a scale and all the other methods, following all the other protocols. The second was nutrition knowledge. So they used a structured questionnaire, which was age and literacy appropriate. And they also assessed the understanding of food groups, balanced diet, importance of meals, including breakfast. The last one was dietary practices. So this is using the validated dietary habits questionnaire and measured the eating patterns and also the meal frequency, as well as assess breakfast consumption, snacking behaviors, and intake of fruits and vegetables. The intervention model. So this was the 4 interventions that the team did. The first one was nutrition education. So they talked about nutrition to children in the Nasavu District School. And the second was healthy eating awareness activities. So they introduced, so they did some activities, fun activities with the students. The third was parent engagement. So they did monthly information sessions for parents and also caregivers, take home nutrition education materials. They also relayed the message that their child is underweight and what are the things that they're supposed to be doing in order to improve their weight status. And the last was health promoting school activities such as physical activity promotion, hygiene. So I believe WASH was also part of this, and teacher orientation, as well as the reinforcement of nutrition messages. So these were the main intervention developed into a model. So the students, parents, teachers, and the school environment sort of improved the nutrition and promoted healthy growth within this school. The results, surprisingly, I mean, I was shocked to see that it was the 100% 31 students that were underweight after 6 months of follow-up. They were all within the normal weight range. So this shows that we just need to relay the right message across and also not do this in silos, but it is supposed to be like a collaborative approach. So getting parents involved, teachers involved. So the other key outcomes was, they also found that there was an average weight change of 1.5 kg, and nutrition knowledge improved as well as dietary practices improved. And there was a more parent and teacher engagement that was more that was simply strengthened. The if a school-based intervention can make a difference in one community, imagine the impact if similar approaches were scaled across the country. This is not only a nutrition issue, It is an education issue, it is a health issue, and ultimately an investment in Fiji's future. Thank you. If you have any questions regarding this study, feel free to email Lynette. All right, so coming to the next big part of the event for this session. So we've heard evidences from Fiji and PNG highlighting several important themes, including nutrition literacy, dietary quality, as well as socioeconomic influences, school food environments, lunch box adequacy, and also the impact of targeted nutrition intervention. These findings provide an excellent foundation to our next segment, which is a Talanoa dialogue that will allow us to reflect on these issues collectively and explore pathways forward for the Pacific region. I would like to invite Associate Professor Pragya Singh, who is the head of School of at the College of Medicine, Nursing and Health Science, School of Public Health and Primary Care, who will moderate the Talanoa dialogue and guide our panel discussion. Thank you.
All our presenters for sharing those very important insights and reflections. What we heard today highlights that student nutrition and school food environments are not just simply the health issues alone. They are deeply connected to our culture, affordability, education, food systems, community realities, and broader social and economic changes happening across the Pacific region. This next Talanoa dialogue is intended to move us beyond presentation and statistics towards honest reflections and practical discussions. We want to explore not only what challenges are there, but also some approaches work and why some struggle to work, and what lessons have we learned from each other in different Pacific Island contexts. Now, I would like to invite the panel members into the discussion. We are very honored to have Assistant Minister of Health, Honorable Mr. Penioni Ravunawa, as one of the panelist members. Sir, I invite you to have your seat here. Mrs. Seni Mary. Professor Georgia. And Mrs. Tracy, who is from Save the Children Australia. So as you can see, we have a very diverse panel. We have participants from Fiji. We also have participants from PNG and Save the Children Australia. So my first question, that is, when we talk about healthy eating in schools, policies, nutrition recommendations, what does actual food environment look for many children across the Pacific today? So you will speak about your individual country. So first to Mrs. Seni Mary, what does it look like for Fiji children?
Thank you. From what we have heard or seen today, maybe there are limitations to what we have shown you. But in Fiji, we have a diverse community, and what we can see is there's a lot of interest in the school nutrition environment or school environment. While we gear towards health and well-being of our children, we have identified that our communities are probably limited to access to healthy food. While they have access to healthy food, the cost has risen over the years. And I think there are reasons to say that. And it seems like the school environment is also a place where people find a place to conduct business. So they are exposed to unhealthy food just probably a few meters away from the school. So while we have home, at the home front, parents are struggling to provide healthy meals for children to take to school. We have what we call the school canteens, especially in urban areas. School canteens are not available in all schools, but where school canteens are available, we also have a special program called the school canteen. We only conduct audit, and it'll be interesting in the future to share information around that environment as well, because what we find is also quite interesting, which is why we feel that our children are exposed to unhealthy food at the school environment. So maybe I will stop there, unless I haven't answered any of the question. Thank you.
Over to our second speaker, if you can give an Australian perspective, what are they actually consuming?
I wanted to give a bit of a perspective from the places that I work with
Sure.
Save the Children, if that's okay.
Yeah, that's
I
fine.
think in Australia, we're quite privileged, and although there are inequities, I think the school food situation, lunch boxes and healthy eating education is quite good. But with my Save the Children hat on, I work with mainly Papua New Guinea, Solomon Islands, and Vanuatu, so I'll mainly be speaking from my experiences there. And these are three countries where there is still a very high burden of undernutrition. So where the previous speaker was saying thinness rates are maybe 3 or 4%, in Papua New Guinea, it's around 16%, I think was the latest national figures for wasting. In Solomons and Vanuatu, it's around 8%. Stunting rates are between a third and half of children are stunted under 5. So we're facing a lot of undernutrition challenges still. So we know for children, the dietary diversity, as Professor also shared, is very poor, particularly in the rural and remote areas, rather than so much in the urban, but even in urban areas, dietary diversity is very focused on carbohydrates and starches, rice and noodles. In Solomon Islands, a very common dish is rice mixed with instant noodles, mixed with a can of tuna, and that might be eaten several times across the day. So children are often not having a great diversity of food at home, let alone in the school environment. There aren't any school feeding programs. Often children, if they're in urban or peri-urban areas, might have access to stores where they'll get crackers, snacks, sugar-sweetened beverages, so those kind of junk foods, maybe 2-minute cup noodles. But in some of the more rural areas, they may not even have that. So a lot of children are also just eating perhaps breakfast at home with breakfast crackers and tea, going to school the whole day, not having food there, and then coming back to eat after at the end of the day. And so, of course, their bellies are hungry. They're not learning the best at school. There's also very high rates of anemia, which just makes them very tired, makes it hard to concentrate. So there's a very strong link between the lack of school food environment and I feel the educational outcomes and well-being of children.
Thank you. Professor Georgia, if you would like to share what is happening in PNG.
Hello. Oh, okay. In PNG, as you've heard, we lack the programs in the schools. And so usually kids come to school with their very light breakfast, maybe some starch, some white bread. They call them scones, but it's like an empty hamburger bun or something like that. Just carbohydrate-rich food if they bring maybe some cooked banana or some cooked cow. wrapped up in a bag or something, or some newspaper. There's a snack that's available on lots of schools. It's actual food. It's a cucumber, but then they take Maggie Cube and sprinkle all over it to give it more taste. And some of the Maggie Cube has iodine fortification to it, so it might be helping them. But in the primary schools, there's been a study, and some of the children have actually too much iodine. Now, at that level, I don't think the preschoolers are getting those, though. They don't go out with spending money very much. And they mainly drink water when they're out and for breakfast. But later on in the day, if they have tea, it's usually tea with sugar. And it's a very carbohydrate-rich diet throughout for most of them. I was in Port Moresby. The diets looked a little better there because these were people who actually had their kids at school. A lot of their kids aren't in school. I think if you notice the two pictures, the public preschool had larger classes. It was a large class, also 3 teachers. The private preschool had a small class and also 3 teachers. And they had sort of classier uniforms or something like that too. But there's a big difference in what the 2 groups are eating. And that's what we found. So I think until we have, in PNG, we're, I think, one of the only countries that does not yet train nutritionists. We hope to start soon. And so the people have not much nutrition literacy at all. And one of my students went out to some remote islands to talk to people, and they had no idea what healthy food is even at all out there. And that's where we have the high stunting rates, and worse, much worse than in PNG, in Port Moresby. Sorry. Thank you.
Sir, I have a different question for you. I understand that in Fiji, majority of the school, I should say what is happening inside the school falls under Ministry of Education, and Ministry of Health can only help them. They do not have a direct say in what happens inside the school. So can you please highlight important challenges which you face in Ministry of Health while advocating healthy food in school environment?
Yeah, thank you for the question. We have to be real with the Fiji situation. The school canteen policy there are the guidelines. We try to put it across to the Ministry of Education, but the enforcement part of it seems to be hanging in the middle. No one is really taking care of the enforcement part of that guideline. And also in our schools, we see kiosks that are parked outside the school fence with all the junk foods that are sold to young people as soon as young children, as soon as they get off the bus to go into their classroom. And also the same story when they get out of school to get back into the bus to go home. So these are a real concern. At policy level, we have to try to review and synchronize our responsibility with the 2 ministries so that we are able to get an impact that is favorable to the upbringing, especially with the nutritional intake of our young people in terms of the development in the academic and also in the brain development and the whole thing that we've been listening to. Also the social economic dimension of families, as we've heard that the wealthy family, like the study in Papua New Guinea, they were more exposed to I call it junk foods and fizzy drinks and the things that are easily available on our streets and in our schools. We have the canteen guideline, as I mentioned earlier, but then these schools, some of the management, they play profit over the health of the students that are in the school community. So these are some of the challenges and some of the concerns that that I've been seeing, and I will also try to improve in our interministerial conversation so that we can improve on that as well. I hope I answered the question.
Yes, thank you, sir. I have same challenges and barrier question for Professor Georgia. Do you face a similar situation as we have it in Fiji?
I think we're not as affluent. Oh, yeah. Sorry, quite similar, I would say, in that the food habits are changing, but not for the better, just changing maybe for the worse. In that it's as I said, the sort of junk foods, the chips, the twisties, the dry snacks that come in little colorful bags. Those things get popular as the kids grow older and have some pocket money. And these white buns are another treat. But at the same time, on the streets, we also have very commonly peanuts, very healthy, boiled peanuts or roasted peanuts for not a lot of money, but to them, it's probably a bit more than some of the other things just brought from home. But that could be very good. I think these things need to be promoted or passed around a few times so that people might get used to it and start to enjoy it and pick it up and encourage their kids to eat them too.
Thank you. Ms. Tracy, I would like you to answer the same question, giving the perspective of the countries where you have worked. The challenges, do those countries also face a similar type of challenge as what Fiji and PNG has discussed?
Yes, certainly. Oh. Hello? Oh, yes, it's on. Certainly similar. And then I would maybe add a few more on top of that in terms of when we're looking at school meal programs, just the sheer number of different barriers to get something started include things like the local food production environment, whether there's surplus local produce that can be fed into a school meal, like that supply chain, procurement, logistics side can be quite underdeveloped in parts of all three countries. Looking at the infrastructure at schools. So many schools don't even have water tanks. A good portion of schools won't have water tanks and clean water, let alone electricity. Cooking will still be, on charcoal and firewood stoves, and then you may not have, unless it's a boarding school, you may not have cooking facilities easily at the school. Then, of course, the financing, sustainability, and political will side. So there's a lot that needs to jigsaw puzzle together to even pilot school feeding programs.
Thank you. So we have heard so many challenges and barriers, and in the presentations which were before, we have seen that there are certain approaches which work very well, while we also know about those approaches which had struggled. So is there any reason why some approaches work better while others struggle? And this is a question to Honorable Assistant Minister.
Thank you. Why do some interventions succeed while others struggle? One of the area is the community ownership. Successful intervention in any of our program has to be community-centered, other than community-driven. People have to take ownership of their own health, and they have to be involved in the planning and also in what we try to achieve in our health strategies, our health implementation program. Another one is the multi-sectoral collaboration. Program work best with health when we come in collaboration with the Ministry of Agriculture, Ministry of Education, our the communities as a whole, our development partners, when we work together and share our common goal. Thirdly, consistent resources and capacity intervention struggle when funding, workforce, all these challenges, training are faced with the program managers. So when the system are weak and inconsistent, that can also be an issue. I also have the integration into existing system. Our program should be sustainable. We should, that's why we come together in Talanoa in the sharing of our success stories so that we can learn from one another and build on something that will be sustainable, already proven to be successful in other setting or other countries. And lastly, the evidence and accountability. Successful intervention uses data. That is very critical. We are doing so much health activities, health intervention programs, but we lack to collect data. And data is important if you want to drive this forward. For successful intervention, we need to have data, we need to monitor our progress, we need to adapt our approaches, and also maybe we also need to be flexible in what we want to demonstrate and to impact our population. Thank you.
Thank you, sir. Thank you so much for your insightful thoughts. Professor Georgia, if you could answer the similar question with PNG perspective.
Okay, what I've seen, I've only heard of one school program that was run quite successfully. It was a nutrition education program brought by UNICEF and maybe others too, but it was with the our National Department of Health and UNICEF. And it was very successful on its own. It was in several schools. Ms. Helen Pollack can tell you about it. She's at the meeting, but I don't see her in the room here today. Oh, no. Yeah, exactly. Okay, but I know she told me that after that ended, nobody took it up. And one of the things I've heard, been listening this morning and up to now, I don't hear much about co-creation. And I think when we bring in these new programs, one thing we can do is try as much as possible to truly partner with the local people or the people who are going to be our target audience and for children and their parents and the schools. And so that they maybe will feel more like taking it on and get some ownership to the work and understand why we're doing it. We don't have a nutrition coordinating office or a national nutrition agency or office, anything in the health system. So we don't have much leadership coming out in sort of running different initiatives around the country. So we don't see leadership either. So I think it's sort of the top leadership is missing, but at the same time, the co-creation, when we do try something, hasn't always been there as strong as it could be. I'm hoping to start some. I mainly work with the 1,000-day people, the infant and young child feeding, and we have some co-creation going on, and we're trying to develop some recipes with our local people, and we'll see how that goes. But we haven't seen anything yet. So.
Thank you, Professor Georgia. So community engagement is important. Moving on to our next question, that is, I would like you to reflect one example, either from your country from which you are or the country in which you are working, that you believe is showing promise and could offer lessons to other Pacific Island countries. Over to Mrs. Senimeri.
From experience and from what we have been doing so far for schools, and health nutrition is one of our core activity as a dietitian in Fiji. So one thing that we have identified that there's very little work that we can do in the school for the student, but there's a lot we can do at home with the parents. So a lot of these nutrition activities have to be done in the community. We have to strengthen our community engagement with our school parents. We have to join the Parents Teachers Association to advocate for our messages. So that is something that worked when we started with our pilot program for school lunch. We joined our PTA. We zoomed into our parents of children that were not responding to the nutrition messages in school and had very underweight and either overweight and obesity. And what we also found that these activities can be very sensitive for certain children. So we cannot be targeting them solely just to reduce weight or have a good lunchbox, because it becomes very sensitive to parents as well. So by roping in the whole community and engaging them with our messages will work. Thank you.
Thank you. Same question to Ms. Tracy. Depending on your experiences in the three country, what do you think why, or if you have an example which you think is working nicely in one of those countries and can be replicated in other Pacific Island countries?
I'm going to rope in another country that I've worked in the past, which is Timor-Leste. And I'm not sure if anyone in the room is from Timor-Leste. Do we have no representatives? Which is a shame because they have a fantastic school feeding program. I'm not sure if many of you will be familiar. So their program started with the World Food Program as the main supporting partner from 2005 or 2006. It was initiated by them together in partnership with the government. The government eventually took over this. So between the Ministry of Health and Ministry of Education, and they've expanded it and grown it. And so now it covers primary schools, secondary schools, and most recently they added preschools. And its governance is somewhat decentralized to the municipalities. They manage this. And when I was working there, I think it was only 25 US cents per meal, which doesn't seem like a lot, but in Timor-Leste, it can go a decent way. And in the municipality I was working in, it was actually only around 5 cents because they couldn't afford the whole quota. But it seems more recently they've increased that, and it's 35 cents for food plus 7 cents for fuel and labor. So in total, 42 cents per child per day for a school meal. And in 2022, they were covering around 60% of students, which I think is fantastic. It's also written into their school food, national school food feeding policy, and that supports local sourcing of produce as well. So it's creating stable demand for farmers, it's supporting the local economy and making sure that the communities are also deeply engaged in the school feeding system. And above all, the government has been prioritizing this. So it just goes to show when there is that political will and they're willing to continually finance and invest in this, how far it can go. So I just wanted to share that in the absence of our Timor-Leste friends, sometimes in the Pacific, sometimes not. Thank you.
Thank you to our panelists for this great panel discussion. Now I will open the floor for discussions. If you have any questions from the audience, or if you have a comment, please raise your hand and tell who you are and from which country are you. And then you can ask your question. Perhaps it will be helpful if you can tell us whom are you directing this question to, if it is specific to any one of our panelists.
My name is Claudia from New Zealand, Aotearoa. My question is to everybody. Does your guys' approach for food in schools cover complex diets and allergies? And if so, how does that work or function in reality? So, for example, we cover special diets back home in New Zealand for maybe children who can't eat whole foods and it has to be processed down. Allergies as well. We cater to that, but I'm really interested to see how others are working within complex diets and allergies.
And your question is directed towards anyone? She's talking about, do you consider allergies when we talk about school lunches? Have you started?
I guess for most of us, in our context, we aren't sophisticated enough yet to accommodate those. And the lack of feeding programs means it's just not a...
You want to answer for Fiji?
For Fiji, we usually advocate on a lot of fruits and vegetables. So we don't have a school feeding program, but we do have boarding school meals, and we do emphasize on the use of our local fruits and vegetables. Thank you.
Second question from the audience.
Thank you. Thank you, Pragya. My questions go to the Good Vice Minister regarding the implementation of the Fiji school canteen. In terms of the enforcement of the canteen regulations, I'm not sure, how do you hold school accountable to if they are not enforcing the standards for the canteen? And because for Papua New Guinea, we're looking at having the food and nutrition policy for schools. That may be something coming in the next, in near future, but then as part of it, there'll be tools for the implementation like the regulation for canteen. So just my question on it, so that we get some experience out of each implementation.
About implementation of school canteen guidelines, how do you plan? We have guidelines, but we don't have strong implementation. How do you want to do it?
So from the Fiji experience, we have a canteen policy, which is under the custodian of the Ministry of Education. So for health, dietitians just audit. We just audit the canteen, all the canteens, and we have that report available. That policy is very strong. However, the Ministry of Education feels that they need to be more involved in the implementation or the planning of the policy. So I think, as far as I know, they are currently drafting another policy, and they probably will involve us in it. So our health messages are very clear. We stand strong on the use of healthy foods in school canteens, and it's very clear on the first policy that was launched in 2016, I guess. So it has a approved list of food items and an unapproved list of food items that can be sold in canteens. So the compliance of that policy lies with the head of school, with the school management. So we hope in the next few years we can be working together with Ministry of Education, because our issue is children are coming out NCD or underweight and thinness. So those are our issues. We'd like to emphasize that because we have children attending dialysis as well. So we'd like to use these indicators to show our partners and our interministerial groups that we need a strong, healthy canteen policy. I think I will stop there.
Thank you to our panelists. Sorry, we are running short of time, but our panelists are here and you can see them face to face during tea time and can speak more about what they have presented today. And big Vinakavakalevu, and thank you from my side for being the part of this panel and for having such interesting discussion. Now I would like to call upon Ritnesh to give the final closing summary.
Thank you, Dr. Pragya. So as we conclude session 6, I would like to sincerely thank all our presenters, panelists, and also the moderator, Dr. Pragya, and all participants for contributing to a rich and thoughtful discussion. I would also like to extend a special Vinakavakalevu to our Honorable Assistant Minister for Health and Medical Services for accepting our last-minute invite to the panel. So throughout today's session, several key messages were emerged. A recurring theme from both the presentations and the Talanoa discussions was that meaningful progress, it requires collaboration, health, education, agriculture, development partners, as well as communities, parents, young people, all have a role to play in creating a healthier food environment for the Pacific children. We also heard that successful initiatives are often those that are culturally relevant, locally driven, and sustainable, as well as supported by strong partnerships. Thank you once again for your participation and commitment to improving child nutrition across our region. Vinakavakalevu, and enjoy the rest of the Pacific School Food Network sessions. Thank you.